Good morning, everybody. Today I'd like to speak to you about eye problems and other visual disturbances that could be more prevalent in the internationally adopted child when compared to the general population. Poor vision and visual acuity is one of the most important medical factors that can contribute to behavioral, developmental, and academic achievements or underachievement in the child if it is left untreated. The actual country of birth for the child is irrelevant, but it has been documented that there is an increase in prevalence of eye problems such as strabismus and amblyopia in the internationally adopted child, especially in the children adopted from Eastern European countries. In infants and little children, in order for the visual development to proceed normally, visual experiences must occur with well-aligned eyes that are free from eye pathology and other visual acuity errors. One of the consequences for not fulfilling these visual requirements during the early years of life could lead to disorders such as strabismus, amblyopia, and decreased visual acuity. In the general population, the aforementioned visual disturbances are reported to occur in 2 to 3% of the general pediatric population. In the United States, physicians and school nurses are very good at screening for such problems. In the case of the institutionalized child, one would speculate that because of the lack of general medical care, conditions such as lazy eye or cross-eyedness would go undiagnosed and untreated for extended periods of time. Basic medical care is generally considered luxury in this country, and those unfortunate enough to reside in an institution are never picked up. Routine vaccinations, correctable surgical conditions, and basic medications such as antibiotics are often lacking in institutions, so why would we expect these children to have an annual visual screening exam? It is therefore should not come as a surprise that many orphan children have amblyopia and strabismus when they arrive in the United States. Amblyopia is defined as a reduced vision in the eye that has not received adequate stimulation or usage during early childhood. It basically means without sight. Amblyopia has many causes, among them being lazy eye. Amblyopia is often a result of this lazy or misalignment of the child's eyes. A lazy eye is seen by an observer as something that is cross-eyed or divergent. Amblyopia also results from a difference in image quality between the two eyes, one focusing better than the other. In both cases, misalignment and weaker focusing of one eye becomes stronger than the other. If this condition persists, the weaker eye may become useless. Visual acuity tests and newer technologies such as the visual evoked potentials are sometimes the best way to screen for these visual disturbances. These screening tests are generally performed at routine well visits and vision screens performed by an ophthalmologist or a school nurse or a pediatrician. The test may pick up abnormalities if they are present at the time of the exam. A child may have normal vision on today's exam, and over the course of the following year, visual disturbances may occur, and it is picked up at the next checkup. This is why the annual visual screenings are performed on children, and it is very important. Strabismus is the misalignment of the visual axis of the eyes. The eyes can turn inwards, outwards, and children appear to be cross-eyed. Strabismus may be caused due to amblyopia. With early diagnosis and treatment, the vision in the lazy eye may be restored if it is at a young age. The earlier the treatment, the better the opportunity to reverse the visual loss. Before treating amblyopia, it may become necessary first to treat the underlying cause. Glasses are commonly prescribed to improve focusing of the misaligned eyes. In extreme cases, surgery may be required to allow both eyes to work together. Eye exercise is a limited form of treatment. The correction may be followed by patching, or covering one eye may be required for a period of time ranging from weeks to as long as 1 year. The better seeing eye is patched, forcing the lazy one to work harder, thereby strengthening its vision. Medication in the form of eye drops or ointment may be used to blur the vision of the good eye in order to force the weaker one to work. This is generally a less successful approach. I am not sure of the exact percentages of strabismus or amblyopia for children that reside in an institution, but in my own personal experience, I have found that there is an increase in referrals that I make to the pediatric ophthalmologist in the internationally adopted cases, especially those from Eastern European countries.